This summer, Lyme disease searches on Google have doubled across North America and Europe, an unusual spike for mid-July. Public health agencies report nearly 50,000 confirmed cases in the U.S. through June 2025, already surpassing last year's total by 30%. In Canada, Ontario's health unit logged a 60% year-over-year rise, while the UK's Public Health England issued an unexpected Level 2 alert for tick-borne infections in southern counties. Experts attribute the surge to an early warm spring and heavy rainfall, which created ideal breeding grounds for Ixodes scapularis, black-legged, and Ixodes ricinus ticks. Videos of ticks crawling on grass and bushes appeared on TikTok this month, amassing millions of views under hashtag #TickSeason2025. In one viral clip, a hiker in Vermont shudders as a tick nest emerges from underbrush, fueling widespread alarm. Clinics in endemic zones are seeing longer wait times. Dr. Anita Patel of Albany Medical Center told local media, "We're diagnosing more erythema migrans rashes in July than ever before." Pharmacies in Connecticut reported a 120% jump in Lyme test kit sales over 2 weeks. Even veterinarians noted unusual tick burdens on pets, driving spikes in tick treatment prescriptions. This real-time case surge and the viral social media coverage has pushed Lyme disease to trend status. Unlike typical peaks in August and September, this early season spike highlights shifting patterns. For many, it's a reminder that tick-borne threats are evolving and that greater vigilance may be required year-round. Lyme disease is caused by the bacterium Borrelia burgdorferi, transmitted through the bite of infected ticks. The disease was first identified in Lyme, Connecticut, in 1975, when a cluster of arthritis-like cases puzzled local physicians. Since then, it has become the most common vector-borne illness in temperate regions. Ticks have a 2-year life cycle. Larvae feed on small mammals, nymphs on rodents and humans, and adults on deer. Nymphal bites, often hard to notice due to their small size, 1 to 2 millimeters, account for most human infections. Early symptoms include the characteristic bullseye rash, erythema migrans, fever, fatigue, and joint pain. If untreated, infection can spread to the heart, nervous system, and joints, causing long-term complications. Prevention has relied on personal protective measures, tick-repellent clothing, daily tick checks, and prompt removal using fine-tipped tweezers. Vaccines were once available, but discontinued in the early 2000s. New candidates are now in clinical trials, with the FDA expected to review one mRNA-based Lyme vaccine by 2026. Ecological factors play a role, too. White-footed mice, the primary reservoir, have flourished in suburban woodlands. Deer populations, natural hosts for adult ticks, have rebounded across North America. Climate change has extended tick-active months, pushing risk earlier into spring and later into fall. Understanding this science is critical as case patterns shift. Public health messaging now emphasizes year-round vigilance, especially in regions previously considered low risk. Tracking how Borrelia adapts and how ticks expand their range remains a major focus for epidemiologists. The Lyme surge has generated a wave of public and online reactions, some helpful, others misleading. Official health agencies like the CDC and Public Health England issued clear guidance on tick removal and symptom monitoring, while local clinics posted tutorial videos on Instagram. These posts trended under hashtag #TickTips, garnering millions of views. Yet alongside factual information, social media buzzed with myths. Some TikTok users claimed that garlic bracelets or vitamin B12 injections could prevent Lyme disease, none of which have scientific backing. A viral WhatsApp forward warned that store-bought repellents cause hormones to spike in children, leading many parents to skip proven DEET formulations. Influencers weighed in too. Outdoor lifestyle creators posted tick-proof, hiking gear reviews, driving sales spikes. Pet care accounts shared pet-friendly tick collars, while DIY blogs encouraged homemade plant sprays, sometimes dangerously untested. The medical community cautioned against misinformation. Dr. Emma Lee, an infectious disease specialist, tweeted, "Only EPA-approved repellents and prompt tick removal have proven efficacy. Please ignore unverified remedies." Despite official corrections, many misleading posts continue to circulate, highlighting the challenge of battling falsehoods in a trending health event. Online forums like Reddit's r/Lyme morphed into debate grounds. Some users lamented delayed diagnoses and insurance hurdles, sharing personal stories of chronic symptoms. Others urged solidarity and directed peers to reputable sources. This blend of accurate alerts and pervasive myths underscores the dual edge of real-time online health discourse. It can save lives with rapid warnings, but also fuel unnecessary fear or risky behaviors. In response to the uptick, health authorities and policymakers are mobilizing new prevention efforts. The U.S. Senate soon will vote on the Tick-Borne Disease Research Act, which would increase NIH funding by $200 million over 5 years to develop next-generation vaccines and rapid diagnostics. At the local level, New York State launched a tick-safe public education campaign, installing QR-coded signs along popular hiking trails that link to removal instructions and nearby testing centers. School districts in tick-endemic regions have begun mandatory tick check drills, modeled on fire drills, to teach students early detection. In Europe, the European Center for Disease Prevention and Control is collaborating with member states to standardize Lyme reporting protocols and tick surveillance. Pilot programs in Germany and Sweden deploy robotic field sensors that count tick populations and transmit real-time data to public dashboards. Environmental interventions are also underway. Some municipalities are experimenting with rodent vaccination, injecting white-footed mice with an oral Borrelia vaccine to lower reservoir infection rates. Controlled field trials in Connecticut showed a 40% drop in infected ticks in vaccinated zones. Meanwhile, the outdoor recreation industry is releasing tick guard clothing lines treated with long-lasting permethrin. Camping gear manufacturers are offering portable tick tents that claim to kill ticks on campers' clothing. These policy and prevention measures represent a multi-pronged approach, science-driven, community-focused, and environmentally conscious. Yet funding gaps and regulatory hurdles remain. Vaccine candidates still require late-stage trials, and ethical reviews delay rodent vaccine deployment. Still, the coordinated push signifies a major shift from reactive treatment to proactive prevention, a sign that the Lyme surge may catalyze lasting public health infrastructure improvements. As Lyme disease's geographic and seasonal patterns shift, many experts point to climate change as a driving force. Warmer winters and earlier springs have extended tick-active seasons by up to 6 weeks in northern states. Milder conditions also allow ticks to thrive at higher altitudes and latitudes, bringing Lyme into previously low-risk areas like southern Canada and Scandinavia. These environmental changes intersect with land use shifts. Suburban sprawl encroaches on woodlands, increasing human-tick encounters. As outdoor recreation booms post-pandemic, more people venture into tick habitats without adequate protection. Looking ahead, researchers warn that Lyme may become endemic year-round in some regions. Climate models project that by 2050, over half of Europe and large swaths of North America will see elevated tick-borne disease risk. That prospect has spurred calls for integrated One Health strategies, coordinated actions across human, animal, and ecosystem health sectors. For individuals, the takeaway is clear. Personal vigilance must become habitual. Doctors recommend daily self-checks during tick season, prompt removal of attached ticks, and awareness of early symptoms. Communities are also urged to maintain backyard perimeters, mowing lawns regularly, and creating tick-unfriendly buffer zones. Ultimately, Lyme's surge reminds us that human health is intertwined with environmental health. As we contend with emerging infectious diseases, proactive measures, from vaccine development to climate resilience, are more critical than ever.